So today we're going to go through a lot of the basics about lymphedema, as well as kind of what to watch for if you're at risk for lymphedema, what to do if you develop any signs and symptoms, and kind of some things to help reduce your risk of lymphedema. Earliest signs of lymphedema. This is where we really like to educate people because this is really important. The earlier we can catch lymphedema happening, the better for the long term. So there are many, many people who don't have any visible swelling. You look at their arm, you look at their leg, it looks fine. It doesn't look bigger than the other side, but they'll come in and they'll say, my arm or leg, it feels full, it feels heavy, it feels tired, it feels achy. Those are all words that if someone describes that to me, even if they don't look swollen, I'm going to think, this may be the early stages of this. They'll also say that, like, if they make a fist or if they bend their knee, that it just feels tight and they feel like they can't move as far as normal. And that's also because there's some fluid built up in there, even if we can't see it. Typically clothes feeling tighter, unless they're snug fitting already, that's not going to be real obvious in the beginning. But I'll also tell men and women to pay attention if you normally wear jewelry on your hands and that suddenly feels tighter. That's another thing to kind of be on the lookout for.
I have a question.
Oh, yes, please.
When you said jewelry feels tighter, that could just mean in the mornings, couldn't it?
It could be. And, some people have fluctuations like that on a normal basis. Like, I mean, I know there's days I put on jewelry and it feels tighter than it did another day. I would say if it's consistently feeling that way, that could be a sign that something's happening. The other thing we're going to get into here is that there's also in the early stages of lymphedema more fluctuation where people wake up in the morning and they say, oh, it doesn't feel as bad or it feels less swollen. And then maybe as the day progresses, it starts getting more swollen. So, just keeping an eye on those symptoms and when it's happening and how often it's happening is important.
Thank you so much.
Sure. So getting into the stages of lymphedema, stage 0 is something that's kind of newer. It hasn't always existed. And this is what we call the latent or subclinical stage. And that's when I was saying the lymphatic system has been damaged. Maybe you had surgery, you had lymph nodes removed, you had radiation. However, everything looks okay. There's no visible swelling, but people are telling us my arm feels heavy, my leg feels full. So people can have stage 0 lymphedema where they have these subjective feelings that, that something doesn't feel right, but everything looks okay to the eye. One of the ways that we normally measure lymphedema is with a tape measure, and we measure around an arm or a leg. But at this stage, even the tape measure doesn't really pick up a difference. So this can happen some people have these feelings forever and it never gets worse. That's the goal, is that we catch it here. We do what needs to be done to prevent it from ever progressing beyond this stage. So this is when we like to see people. We have some doctors who will refer to us immediately after surgery or before there's any issues at all. And they will say, hey, just educate this person about lymphedema. So we take some baseline measurements and then we just teach them basically a lot of these things and what to watch for. And then the great thing about that is I tell them, if you ever have any of these symptoms, all you have to do is call me. I'll do the paperwork in with your doctor as far as getting you referred back to me. But then people can come anytime they want to and make sure everything's okay. And I frequently get people who will say, they come in and see me and they're like, I don't think anything's wrong. I don't want to waste your time. And I'm like, I would rather see someone and be able to say, hey, everything looks good, than have them be worried that something's happening. So, Judy.
Brenda, this is Judy. I'm going to jump in and ask a question if I might.
Yes, please.
You talked about stages and the progression of lymphedema over months and years. Does it always progress if it's not treated early?
If you don't do any treatment at all, it's typically going to progress, but treatment at any stage is better than none. So even if it's progressed into a later stage, we'd still like to treat that just to prevent it from getting any worse. And we can make good gains as far as getting it back down. So, and that's another thing. I have people who come to me because Lymphedema in and of itself is not necessarily painful. It may, if it gets bad enough, start limiting people's mobility and things. But I have people come in and they're like, I don't know why I need to worry about this. I don't care that my arm or leg is swollen. My doctor just told me I had to come here. And so then it's a little bit of education of why is it important to take care of this so it doesn't keep progressing. And we're going to talk later about if it's not treated, what it can lead to and why it's important to do the treatment. But yeah, early intervention is really the key to prevent it from getting worse over
Right.
years.
Thank you.
Sure. So at the stage 0, we talked about tape measures typically don't do a lot to catch it at this stage. So they do have some advances in technology. I know they have these at some of the KU clinics, the cancer centers. So there's something called bioimpedance spectroscopy. This gentleman in this picture is standing on a device. It's called a sozo. It kind of looks like a scale, and you put your hands on these plates, and it basically uses a painless electrical current. And I promise it really is painless. People don't feel a thing, but it can detect subtle changes in volume or fluid. So this says as small as 2.4 tablespoons difference between like a left and a right arm or a leg. And so in an ideal world, everyone would get this test. And I know that like at the main KU campus, they have some lymphedema nurses there, and they use this regularly to monitor people and try to prevent lymphedema. And so if someone's been doing the sozo and their scores have been stable, and then all of a sudden they have an increase where it's like, oops, something's happening, that's when then they refer the person in for treatment so we can get on it and try to keep it from getting any worse. So these kind of devices are very, very handy. So if we progress out of stage 0, we end up in stage 1. This is where you are actually going to see some of the swelling. But if you notice with this picture, it's pretty subtle. This typically will be the kind that people wake up in the morning and they're like, oh, my arm or my leg actually looks kind of what they consider normal. And then as the day progresses, it tends to get worse. They may have what's called pitting edema, where if you press into the swelling for a second and lift up your finger, it leaves kind of like a little dip in the skin. Typically at this stage, elevation will be useful and will help reduce the swelling. I will say, when I talk about it being better in the morning, worse as the day progresses, that is typical for an arm or a leg swelling. For our head and neck swelling, it actually tends to be the opposite. When those patients lay down at night to sleep, especially if they're laying fairly flat, the fluid kind of moves up that direction. Then so they get worse in the morning. And then as the day goes on, gravity kind of helps with that. And they may get actually better as the day goes on. So there is a little difference with those two types. Stage 2 is where we've progressed even further. At this point, people are usually saying, it doesn't fluctuate anymore. It's not better in the morning. It just kind of stays this way all the time. As it progresses, you start to get like a thickening of the skin. And I have a picture later. We'll talk about that some more. It's called fibrosis. And this is where you're moving into the stage where you're going to be more at risk for infections and some more chronic problems if it's not treated. Now, I still get a few people at this stage, but it's pretty uncommon. I would say most of the time I'm seeing people at stage 0 or 1. Now, stage 3 is where the swollen area is very, very large. It's going to interfere with being able to get dressed, being able to walk. Movement becomes more difficult. In the most significant cases, there comes a point where the fluid just doesn't have anywhere to go, and it can actually kind of start leaking out of the skin. It's usually just a clear fluid, but we can see people who it just leaks and kind of weeps out of their skin. This is also a really high risk for infection. So we really would like to do everything in our power to ever prevent getting to this stage. So when is it important to get help? I would say the earlier the better. I don't think anyone can get an opinion about their lymphedema too soon. And like I said, I just had a lady very recently who came in and she said, I really hope I'm not wasting your time. She said, I really don't think I have lymphedema, but I'm just really paranoid about it and really worried about developing it. And so I just want to make sure. And I was like, well, I would rather meet people at that stage and be able to give them some reassurance and some, kind of tricks to help minimize the risk of them developing it, than have them just be worried about it all the time. So any of the symptoms, even just that, hey, it doesn't look swollen, but it feels heavy, it feels achy, that's when I would suggest people let their doctor know, especially if you have an ongoing relationship with your oncologist or radiation oncologist. Any of those doctors, they are all pretty darn familiar with lymphedema and are really great about referring. Primary care doctors, I feel like they are getting more and more familiar with lymphedema. But I've also had some of them tell me, like, we touched on lymphedema like one day in medical school, and it's not something they learn a ton about. So I have told patients before, if they have met me, even just for education, I say, call me if you have issues, or they email me, because then I can reach out to their doctor and say, hey, this is what's happening. I need to see them again. Will you just send me an order over? And it's really easy. The other thing to know is that therapists who do lymphedema, or just we have oncology rehab therapists who don't do lymphedema, they do some other things. If people are having issues like with stiffness in their tissues and they can't move their arm up over their head, or they can't move their legs they want to because they've had radiation and they have fibrosis, or we see a lot of patients with chemo and radiation who have significant fatigue issues or neuropathy, we can typically help with those things as well. So the cancer rehab world, just to kind of tie it all in, includes a lot of things. So sometimes those things go together. Sometimes when patients have radiation and they have that fibrosis where their tissues are tight and they don't move very well, that can actually impede some of that flow of fluid as well, so treating that stiffness can actually help with the swelling and the lymphedema. So this is when I said we we're going to talk about why treatment was important. So if you look at these legs and you can see that skin that looks kind of scaly and dry and thick, this is what happens if lymphedema progresses. So we start getting that what we call fibrosis. The skin gets thick, it's firm to the touch. You get trouble with infections. If someone with skin like this ends up with open wounds, they tend to be very difficult to heal because of the excess fluid. And so a lot of times, if someone has wounds, they'll have us treat their lymphedema, and it's amazing how much quicker those wounds will heal if we can get some of that swelling out. Depending on the body area, and I've kind of touched on this, that's affected, it's also important to get treatment because this can really interfere with daily life. Other than just normal walking, getting out of the car, going up and down stairs, like if you look at this swollen leg and you could think about how heavy that probably is, think about trying to lift it in and out of bed, being able to get a pair of pants over that or a pair of shoes. We frequently ask our patients when they come to see us, like, how are your clothes fitting? And it's not unusual for people with swelling in their leg to say, oh, I had to buy a new pair of shoes in a bigger size or a wide pair of shoes, or they just don't have any shoes that fit and they're wearing slippers. And so being able to get that down is really important, particularly for people who are still working. We get people who have to wear certain things to work and they can't do that right now because of their swelling. So it's really important to get this under control just to make all those daily tasks a little bit easier. So actual lymphedema treatment has two phases. Complete decongestive therapy, which is referred to as CDT, is kind of the gold standard of treatment and has been for years and years. I will say we get some patients who come back, they've had treatment before and they're like, surely there's something new. And it's like, it's kind of standard and it works well, so we're sticking with it. The four main components are compression, which sometimes is done with bandaging, which is a technique we use. Sometimes it's more of just like a sleeve or a stocking, but some kind of compression. Manual lymphatic drainage is a manual technique. We will call it massage when we talk to our patients. It is nothing like a massage you actually go and pay for, which is really deep. This is a very light touch, but what it does is it moves the fluid. So let's say your right arm has swelling in it and you had lymph nodes taken out of your right armpit. We want to basically direct that fluid with our manual techniques to move to the nearest places that haven't had lymph nodes bothered, which would be the opposite armpit and the kind of the groin and the hip on the same side as that arm. So it's a technique that we do on the patient to help move the fluid. And we can also teach people how to do it to themselves at home. They either do it themselves. If they have a family member that wants to help, the family member can do it, whichever. Remedial decongestive exercises are just basic movements. They're not fancy like gym exercises. They're literally just moving a body part actively to get that muscle pump, which also helps facilitate the movement of the fluid. And then skincare is just super important because we want to always reduce the risk of infection and prevent infections. So there's two phases of treatment. The first one is the intensive phase where you're actually going and working with a therapist. You may go 2 to 3 times a week, depending on insurance and your goals and how bad your swelling is. And the goal of this therapy is to get the volume, the size of your arm or leg or swollen body part down as much as we can. Then we move into the self-management phase, which is to help you manage this long-term. One thing I hadn't mentioned yet, lymphedema is not considered curable, it's considered manageable. So if someone develops lymphedema and they get especially to phase like stage 2 or 3, it's not just going to magically go away and never come back. We can control it really well. We can get it down to where the size is not significantly different than the unaffected side, but it's going to take long-term management with a compression sleeve, compression socks, things like that to keep this under control long-term. Treatment should be performed by someone who has been trained. Typically, pretty much any medical specialty can get trained in lymphedema, nurses, OTs, PTs. It's typically 135 hours of coursework. Training in the head and neck actually goes a little beyond that. I know when I took my initial course, I definitely did not feel prepared to treat head and neck lymphedema after that first course. I definitely needed that second course to feel really confident in that. There are places you can find lymphedema therapists. Honestly, your oncologist, radiation oncologist, surgeons, you know, especially if they do a lot of cancer surgeries, they probably are familiar with people in your area. But there are other places that you can look up online that gives like a kind of a directory of therapists who've completed the coursework. There's different schools of lymphatic training, and they're all basically the same theories and concepts. So all the treatment's pretty similar. This is just an example of treatment results. So this gentleman on the left had a head and neck cancer. But you can see he had really significant swelling. He also had a trach, which we know how to work around and kind of do that, but significant reduction in his swelling, which probably made eating and a lot of things much easier for him. The arms on the other side show, you know, that affected arm isn't as small as the other side, but it's sure a heck of a lot better and much closer in size. It's going to be easier to move. It's going to be easier to find clothes to fit on there. So I tell people the treatment is really effective. Sometimes it's a lot of work in some stages, especially if we have to wrap an arm or a leg.